respected regional directors, program in charges, academic counselors, and dear learners of post-basic BSc nursing program. Today, I will be discussing one of the important topic which has been taken from BNSL 209, that is Community Health Nursing Practical, Suturing of Superficial Wound. Dear learners, I would like to make you ensure that this BNSL 209 is Practical Manual 2 and it is being integrated in post-basic BSc nursing from Community Health Nursing Program since 2023. When you all were in 2023 as first year students, that time onwards we have integrated community health program with the post-basic BSc nursing program. The advantage of this is that you will get the advantage of working in the community if you want to opt in future, as presently all of you might be working as nursing officers in very big hospitals in the metropolitan cities, but as you are aware that IGNOU has launched Certificate in Community Health Program in the year 2017, and they are all being placed in health and wellness centers, or we can say Ayushman Arogya Mandirs, as community health officers. We had received this demand from many of the students previously. Then the permission was taken from Ministry of Health and Family Welfare, and also permission from Indian Nursing Council was taken to include the component of CCH program in post-basic BSc nursing also, so that you have interest in the community, and if anybody want to work in the community can get the advantage along with this your as present job. So with that, an logbook was introduced from 2023 batch, as well as the Practical Manual 2, which you are to be completed in 2025 with third year. So during the implementation stage, we came across many of the students that they were not aware of this CCH integration or logbook, and they were even not supplied with the logbook along with their first year material. So it has been taken, matter has been taken up with the MPDD, and follow up is being done. And otherwise, because you are in third year now, so you can download this logbook and Practical Manual 2, which is available on eGyan Kosh also, so that the purpose of logbook introduction is that you can document all the procedures in your logbook, whether it is related to first year, second year, or third year. So you can document your findings in the logbook, because formats are there, and now it is easy for you to do the recording, because every guideline is available. So with that information, I would come to the topic for today's discussion, that is suturing of superficial wound. You all might be coming across wounds, variety of wounds, or minor wounds or major wounds in the hospital setting or in nearby areas. And the same when you will be posted in the community for your practical posting, there also you can meet some or the other person having some wound, which can be minor, or it can be major, or it can be infected. So what all you are doing, or you are taking care of various wounds in the hospital setting, and how you are going to, what are the purposes of taking care of wound, you are very well aware. You are doing it on the daily basis in your hospital settings, so we will not go in much detail, but as it is one of the practical, so you can even do it as a self activity in your logbook, where it is being given in the logbook. The guidelines as well as practical manual 2 has got the detailed description of this topic. So the wound can be lacerated wound which require suturing and management. So when the wound is not sutured properly, improperly sutured wound can lead to breakdown, infection as well as poor healing. So it is very important that how you are going to take care of the wound, and if the wound is in a position to be sutured, it should be sutured properly, correctly, without any mistake on your part. So if that is done, then it can lead to various infections and poor healing. So why do we need to clean the wound? It is to wound should be cleaned properly so that it can be stitched and dressed, and of the minor wounds. You should know also when to do the suturing and when not to do the suturing. And also it provide or supervise the home care and follow up, identify the danger signs. So you can identify whether the wound is healing properly or whether the wound is not healed properly, whether it is getting infected or it is taking time for healing. So all these things, whether there is redness or swelling, pain is also there, so you can identify danger sign. Even the fever is one of the indication that the wound is not being taken care properly. So you have to be very alert about the care of the wound. So when we say immediate wound care, so all wound needs some kind of cleansing. As suppose there is an injury which is near the eye or in the eye, so simplest is the toileting or cleansing the wound with the help of taking the swab and dabbing it on the injured site and touching it very lightly, because it is the sensitive part of the body. And you can use the antiseptic after ordinary washing and explore for any obvious dust in the wound. If the wound is having any dust or so, you can explore that, and so that it can be cleaned. So there can be various types of wounds. As I told you before also, the most wound need more than this, because it is not that the minor wound needs some kind of simplest procedure to be followed, but if the wound is very major and it is affecting other part of the body also, like open wound, there is a bleeding in the wound, so, and some wounds having dead tissues around, so you have to take care by doing the dressing in a deeper wound. It will be a major kind of dressing. So more the dead tissues, the more thorough must be the dressing of the wound. So when we say the dressing of the wound, it is done for the protection of the wound. There should not be any, wound has happened, but now you can prevent occurrence of more infection in that wound. If their wound is having some discharge, so that discharge has to be absorbed. So for that, dressing is required. If the wound is with the bleeding, so you need to control the bleeding. And also dressing is done to further avoid the injury. So these are the main immediate care you have to give in case of the wound. Now comes the contraindications, where the dressing, or you need not to cover the wound, or areas which needs to be looked after much more in detail rather than covering them up. So what are these conditions? If there is any foul discharge, so the foul discharge, it can be due to bacteria or other pathogens which enters a wound, an infection can occur. So if there is infection in the wound, it can increase the pain, swelling and redness. So more severe infection may cause even nausea, chills and fever. So in that case, it need not to be covered. Then lymphadenitis, like inflammation of the lymphatic vessels. In this case also, it is dressing need not to be done. It is a possible medical emergency, as involvement of the lymphatic system allows for an infection to spread rapidly. Because of the circulation of the lymph in the lymphatic vessels, it may circulate from one part of the, circulate in various parts of the body, and it can cause systemic infection. So lymphadenitis, in that case also, wound need not to be dressed up. Then in case of lymphadenitis, again, in that case, you need to apply a warm and wet compress, such as the washcloth dipped in a hot water and wrung out. So you can apply that hot fomentation, we can say, to the affected area rather than doing the dressing. So take an over-the-counter pain relief can be taken. These include either aspirin or the ibuprofen. So these are the three conditions in which dressing is contraindicated, depending upon the situation and condition of the patient. Now comes the types of dressing. As you all are nursing officers working in various departments or in the wards, medical ward, surgical ward, in ICU, some of you are working in critical care unit. So I think these things are simple for you. Like one of the simplest, or in the community itself, you can use adhesive dressing, that is Band-Aid, which everybody knows. It comes in various sizes, and these are sterile dressings of different kinds and consist of pads of the absorbent gauze. It is need to be applied. To apply this, surrounding skin must be dry before application. If the skin will be moist, it will come out easily. So you need to keep the around that wound dressing. It should be dry, as well as edges of the dressing need to be pressed so that it remains firm over there, or the injured parts. So this is the one type of adhesive dressing or Band-Aid. Now other type is the non-adhesive dressing. In this, again, it is ready-made sterile dressing, which consists of layers of gauze covered by a pad of cotton wool with an attached roller bandage to hold it in position. As it is shown there in the figure also, these are enclosed and sealed in protective covering, and also these are available in various sizes. So the other type is the non-adhesive type of dressing. Now comes the gauze dressing. You all are in the hospital, might be getting supply from the Central Supply Department, CSSD, where sterile gauze pads are available, and these are basically autoclaved, and they are being used for the wound to be covered and to protect them from infection. In case of minor wound, or in the case of large wounds, as it is having an absorbent in it, they are soft and pliable, and it is liable to adhere to the wound. So if it adhere to the wound and next time you want to remove that dressing, it needs to be wet first with the sterile normal saline, so that it comes out easily. Otherwise, when you just pull it out, skin might come along with it. So you have to be careful. Then come types of improvised dressing. Improvised means this can be prepared with any clean, soft, absorbent material, such as a clean handkerchief or a piece of linen, a clean paper, even we can say tissue paper, etc. Even a SOHS can be cut out to be used as crepe or the pressure constriction bandage, and this will be this knowledge of improvised dressing you can utilize when you will be having practicals in the community, because in the hospital you will get every supply, But in the community, you need to improvise. Improvise means whatever is available with you, you have to utilize that material for the care of the people in the community. So it can be a handkerchief, it can be a socks, depending upon the what is the kind of wound you are meeting in the community area. So these are various kind of dressing. Now you also need to keep some points in mind while you are taking care of the wound. So first of all is, need not to tell, but it is very important that wash hand thoroughly before the dressing. It is very important so that you does not give additional infection from your hands to the patient who is coming to you for treatment. Then avoid touching of the wounds with fingers. You need to wear the gloves as well as use aseptic technique. That means everything should be autoclaved, your whatever forceps or your dressing material, any medication you are using, you should keep it in a aseptic place. Do not talk or cough over the wound. It is a seen as common practice that while you are doing the wound dressing, at the same time you are doing your conversation, whether with other colleague or with the doctors or other health team. So don't realize that droplets are coming out of your mouth. They can give infection, additional infection in the wound, even if you are using all aseptic techniques. So that you have to see that you are not going to talk or cough over the wound. That is why most of the time you are wearing mask also while doing the procedure using aseptic technique. If the dressing stick to the wound, then do not try to pull it, but you remove gently by wetting the wound with the sterile saline solution, as I told you earlier. Then all these articles are available in the hospital, like kidney tray, paper bags, Savlon, Dettol, thumb forceps, artery forceps, syringes, scissors, medication in case it is needed, and spirit, gloves, etc. So that can be kept, and you can improvise in the community setting accordingly what can be used. Then the dressing of the wound, there can be a social dressing or there can be surgical dressing. So in the community, mostly we are not having much of the resources when we are doing home visiting, or in case autoclaved material we are short of in the community. So you can do the social cleansing of the wound if you come across. So pack the patient's wound with the sterile swab to keep it dry while you clean the skin around it with the tap water. So you have soap and tap water, so you need to use that, and a nail brush can be used if there is any dirt and you want to clean the skin. Then if the dirt is there, then you can use a soft boiled nail brush. With the gentle rotating movements, you can remove the dust, and using the scrubbed hand, or if you have gloves, you are wearing gloves. So with that you will hold the dirt area in circular movement. With using nail brush, you try to remove the dirt from the wound gently. Do not use vigorous side to side scrubbing movements. It should not be harsh or vigorous in movement. It can further damage the patient and increase the wound. So put a basin under the wound, pour clean water over it continuously, so that whatever water you are putting on the wound, it goes in that bucket or that basin, whatever you have put, so that surrounding is not destroyed or make it unclean. So environment also is very important. Where you are doing the brushing, it should also be clean. As I told you, you can do social cleansing of the wound, And now surgical cleansing of the wound. In surgical cleansing, like around the wound, you need to paint the skin with citramide or chlorhexidine, and but avoid use of iodine, because this will damage more tissues. So that you can keep in mind, and drape it or cover it with the clean cotton, only exposing the wound part. Rest of the skin is you have taken care using the chlorhexidine paint, and now you can give good care to the wound. And why we are cleaning that skin around? So that any infection should not go from the skin to the wound also. So you need to remember that treat the tissues in a gentle movement, rather than additional injury is caused. So it has to be treated very kindly, and don't grab them with the large artery forceps. If the wound is small and you are using forceps of bigger size, so it will again damage the more tissues. So you need to take care of that. And also do not swab them violently. It has to be gentle movement, and this injury, because this can cause injury and make them less liable to resist infection. So chances of infection increases if the wound is small. You are using inappropriate forceps for cleansing the wound. So points you need to keep in mind while cleansing the wound. You need to use a pair of forceps to wash away all dirt as well as the ingrained mud, because wound can happen anywhere, whether it is roadside or working in the kitchen, or having a fall on the dust. So you have to see or assess the situation where the wound has occurred, and accordingly you need to take the articles to do care of the wound. And whether it is mud around or dust around, or so it can be glass, some cut is there from the breakage of glass or something. So you have to see. Then flush smaller foreign bodies out of the wound with sterile normal saline. You can do the flushing of the wound with this using a syringe, and sterile water in a 50 ml of syringe, or an ear syringe can also be used, and you have to give a pressure from the syringe on the wound, so that it removes the foreign bodies which are present on the wound. As I told you, it can be some glass pieces or something. So, and find pieces of wood can also be there, metal, and the gravel or the clothing. So whatsoever is there, it can be do irrigation or syringing. Again, you explore the patient's wound, like probing for the foreign material. Only you have just, as I told you, there is foreign material on the wound. It is not just that you have explored that yes, foreign material was there on the wound and you have tried to remove. But this is not enough. If necessary, open it widely to look into its depth. How deep is the wound? You can also see how deep the wound is, so that only removing the thing will not be enough. If for any reason leave a foreign body, such as deeply embedded, if it is a bullet injury, it has gone deep, so in that case tell the patient so that it cannot be removed by you then and there. Thing is that it has to be now further taken to higher health facility for removal of the deep-sighted foreign body. Foreign body can be a gunshot injury also. So other thing can be remove all clots or joint ups, all cavities, so that they drain easily, in case it is required. Injured tissues in a wound like as wound is there when the tissues are injured. So you need to assess the condition of the wound. Patient may be referred to higher health facility for the proper care later on. But initially you have taken care of wound, you have given the first aid kind of thing, cleansing a wound, preventing infection, you have dressed up the wound, and further injury can be hampered, and patient is now safely taken to the higher health facility for proper management. With that, I conclude the session. Thank you very much for patient listening. Thank you.